What happens when you can't have a child? What happens when you have a medical issue or some situation because of which you're struggling to have a child?
Interpersonal relationships getting disturbed, day-to-day life getting disturbed, depression, frustration. It is something which they will never talk about it. Sometimes it takes courage to talk about it.
Why do people have infertility?
1 in 6 couples is suffering from infertility. That high is the incidence today.
What do you mean by lifestyle? How does lifestyle impact your fertility? Okay, my God, I didn't know that, this level of intricate detail is going to impact people's fertility and ability to have kids or not. Things like alcohol, smoking are more and
gym
more common.
supplements, not to forget, gym supplements.
What about the child who's produced finally? Is there any difference? For the genuine couples, how do they find out that this is a good place to come to? What questions should they come with? Or how many such couples have you worked with? Approximately, I'm sure you don't know the number, but...
More than 10,000 couples.
Wow. What habits should I inculcate to make sure I don't face infertility? So one of the biggest goals that couples have is to have a child. That's a big dream every couple during their marriage develop. What happens when you can't have a child? What happens when you have a medical issue or some situation because of which you're struggling to have a child? Today, I'm very fortunate and excited because we have a very special guest in the studio who's an expert in this field, Dr. Jyoti Bali, who's a director of Baby Soon and has helped thousands of couples in India to have a child. Dr. Bali, thank you so much for taking out time and coming and speaking to us about all this.
My pleasure, Neeraj sir.
So do you understand, do you agree with me that it's a big challenge that couples face when they figure out we can't have a child for some reason?
Absolutely. It's so much frustrating, so much of emotions involved there. Depression, frustration, interpersonal relationships getting disturbed, day-to-day life getting disturbed, anxious personalities coming out at this point of time when the couples start, getting into it, that realization that, they are not able to conceive. It is something which they will never talk about it. Sometimes it takes courage to talk about it. And maybe they'll keep, close to their chest for quite some time unless they are supported by the family or near ones or dear ones to come out and take help. It's not easy for them to, sometimes accept it.
How many such couples have you worked with? Approximately, I'm sure you don't know the number, but...
More than 10,000 couples.
Wow. And for how long have you been practicing?
2010 to present date.
Okay. So
for infertility specifically.
Okay.
But as a gynecologist, from 2003 to 2024. But only with IVF from 2010 to 2024.
So let's start from the reason, right? Why do people have infertility? Are there very knowable reasons? Are there reasons that we know of? Is the background to it understandable, or is it something that we don't know?
No, it is very much understandable, but there are few cases where you don't find a diagnosis, and if they're yet not able to conceive, they've been trying for quite some time, well, then those cases are labeled as unexplained infertility. But most of the cases you do find reasons as to why they are not able to conceive. 1 in 6 couples is suffering from infertility. That high is the incidence today.
Wow.
And if you look at the reasons, 50% causative factors will be found in females and 50% is male infertility. It's absolutely equal incidence in both the partners. So with, I think, modern times, it's lifestyle, food habits, the stress levels are all contributing factors. And of course, late marriages for the girls, which was not there earlier.
Right.
So this is again a factor which is responsible for infertility, because biological clock for women is ticking all the time. So the best option for these girls who are young, they want to, find Mr. Right, settle their careers, be financially independent, because that is also very important. So to all those girls, I would say, don't freeze your dreams. Go ahead. It's a very simple procedure, 12 days of injections with stimulation, and freeze your eggs, not your dreams. Because that will give you a lot of time to, find your choice of, make a choice with your partner, whom you want to spend your rest of your life with, settle your career, finish your master's or your education or your commitments with your job. And when you are financially independent, and more so, when you are mentally ready to be a parent, plan that time. So this will solve the purpose, because the freezing of eggs, you frozen today when you are 28 or maybe 30, and you want to plan your family when you're 36. Well, the age of the eggs is when you froze them.
Oh.
So that is where the advantage comes. So these are the options that I would like to give them.
So freeze your eggs, not your dreams.
Not your dreams.
What a nice
Certainly.
thing to say.
And that gives freedom to all the young girls today. Because after all, their dreams are important. Their finding Mr. Right is important. Financial independence is important in today's times for a woman. So why not? And then having a child is equally important. So she has to balance everything in that given span of time. Right, all in her peak 30s. Late 20s, peak 30s.
Right.
So there's limited time there for everything. So she has to balance it out. And these are the options that I would suggest.
And if that's what a girl decides to do at 28, 30, they decide to freeze their eggs.
Absolutely.
What's the success rate?
Very good success.
Does it always work? Does it?
Depending on what her AMH, her ovarian reserve was, how many eggs have been frozen, that individualization of the case will be done by us.
Sure.
As to when she came to us, maybe let's say she's 28, but her AMH is good and she's frozen about 8 to 10 eggs. Good chance that she'll have one child out of it. And quality was good. Then it'll depend again when her partner's semen is seen, or the sperm quality of the male is seen. But let's say at 28, her AMH is less and she had only 3, then we'll ask her to have multiple IVF cycles or multiple stimulations to freeze at least 8 to 10 eggs minimum. So this is how it has to be individualized. One size will not fit all.
Going back, you said the causes are, you mentioned multiple, and I want to go into them one by one to get into the next level of detail. So when you said lifestyle, what do you mean by lifestyle? How does lifestyle impact your fertility?
See, lifestyle has various components into it. First of all, let's talk about the food habits today.
Okay.
Right from teenagers, your body is what you eat. So junk food has taken up a lot of importance in everybody's life. Obesity, then no exercise. Everybody is on gadgets these days, even the young children, laptops, mobiles. Who is without it, tell me? I see young children in my own house, 9-year-old, they are with a mobile, they are with an iPad. So outdoor games, exercise not there. Food habits have changed for right from childhood to adolescence to young people. And then the work-life balance for people who are working. Mm-hmm. The kind of quality of life has gone down. Socialization is less. That happiness is missing.
Food habits, so junk food impacts your fertility?
Yes, it does, because obesity will be there. Weight is not in the ideal for your height and for your... Obesity is a causative factor. It does impact in fertility chances.
Wow. Okay.
And ovulation is impacted directly. It has a direct relationship there. Then stress levels are high. That also impacts sleep pattern. Working all through. For males, I would say keeping their mobiles, radiation from the mobiles, using their laptops, keeping it on the laps, and less time with the spouse and more with the mouse. Where is the time?
Right.
There is no time. When you take history, their sexual history, sometimes you get to know that they have not been together and they have landed up into stress and they're not been able to conceive because the time factor is missing between the couple. And then they come and say that, let's have the treatment. It's a press button technique. IVF is not a press button technique that, you press a button and IVF produces a baby for you. So I think lifestyle is important. Everything needs to be given attention to.
Okay, my God, I didn't know that, this level of intricate detail is going to impact people's fertility and ability to have kids or not. What about, these days, and for all the right reasons, there is more gender equality. Boys and girls both want to have great careers.
Absolutely.
Great careers come with great
Absolutely.
stress, with travel and all that. Now, high-profile corporate jobs, adding a lot of high-profile stress impacts
Absolutely. Yes, it does.
fertility?
Yes, it does.
Yeah.
It does.
So, and what's the option? Again, go back and freeze the eggs or reduce your stress?
Everything needs to be put into place. You need to focus on yourself, give yourself some priority there.
Right.
Self-love is important. And make this as an agenda then and, focus on it and do it.
Right. Right.
and
Okay.
take help at the right time.
Okay. Okay. Coming further to today's youth and their habits, again, I'm not trying to criticize it, but things like alcohol, smoking are more
And
and
gym
more common.
supplements, not to forget,
Gym
gym
supplements.
supplements.
Oh, all these things have a negative impact?
Yes,
Oh, really? Okay. So if people are chain smokers or drinking quite often,
yes,
it could have an impact
yes,
on their ability to produce.
yes.
Wow. Gym supplements are good for health, right?
No. So if they're, supplements have testosterone levels there. If they, that is what they are taking. Negative impact on the semen later on. And most of the cases when we take the history and we find out that these supplements were taken, deranged parameters for sperm. So these added substances should not be taken with hormones there.
Very interesting. Very interesting. Okay. Now, the other thing you said is, and I forgot what you said, but you said 12 weeks or 12 injections or
12 days of stimulation is required, 10 to 12 days, I would say. Average is 10 days. Some cases maybe 12 days with polycystic ovaries. 10 to 12 days of stimulation injections. And in this 10 to 12 days, there are 4 to 5 ultrasounds. And then the eggs are harvested from the ovary. There is no cut, no suture on the body. It is short anesthesia given. So it's a very comfortable procedure. The girl has to just get admitted on the same day and she'll be discharged in the evening.
Oh.
So 4 to 6 hours of stay in the hospital and no cut, no suture. So it's a very painless procedure. And the
Okay.
eggs are frozen in the
Okay.
embryology lab.
and almost anyone can do it?
Yes.
Like any girl
Yes.
in the right age
Yes.
can do it?
Yes.
Okay. And what is the cost?
The cost involved,
Approximately, I'm sure it
approximate
varies.
cost would be somewhere around 1.5.
Okay.
And we give them installments, we help them out if there's anything. It's like your LIC policy. Please buy it and keep it.
Oh, so 1.5 lakhs or approximately that amount is for this procedure?
For all the injections and the procedure, everything inclusive, minimum is this much.
Okay. Now you want to freeze your eggs?
Yes.
For how many years can you freeze your eggs?
Minimum 5. More than that also is possible, 5 to
When you
7.
say minimum 5, what do you mean?
I mean, you can freeze it easily for 5 years. If you
Okay.
want it longer, you have to inform the clinic and we can continue freezing it for longer than that as well.
Okay. So these are kept with you?
Absolutely. They're kept in the embryology lab
Okay.
in liquid nitrogen tanks at minus 197 degree temperature.
And there is a cost to that?
Absolutely, there is a cost to it.
Okay. Okay.
Average about 4,000 per month to 5,000 per month.
Right.
It can go up to 8,000 per month also, depending on the number of straws and things like that.
Okay. Okay. Now, does this mean that this is a solution, though? I mean, great that there is a solution,
Yes,
but it's a solution largely for people who can afford this,
absolutely.
right? So the poor guy who is not able to have children, for him it's going to be very difficult to
Very difficult.
go through this process.
Yes.
Or are the government hospitals also offering these kind of things for free?
Not really.
No.
No.
So you have to go to a private clinic.
Government hospitals do have some IVF labs, but not for egg freezing. As to whether they are doing it or not, I'm not too sure. But it can be done, but
Right.
not for free. Of course, they also charge for the injections. Even IVF is charged in government hospitals, and minimum charge is 40 to 50K for the injections they charge. And the waiting time is 2 years sometimes for patients to get through that line.
Understandable. Yeah, fair enough. Okay. Now, this is all about the process, right? What about the laws around it?
That's
Am
a
I
good
doing
question.
something illegal trying to do this?
No, no.
Or
with
it's legal?
Absolutely legal. Egg
Okay.
freezing is absolutely legal.
Okay.
And IVF is also legal. There is nothing, the law is around surrogacy. And age limit with ART law is that any woman who's had, her age should be 50, not more than that. And for a male is 55.
Okay. So up to 50 or 55,
Yes.
you can go through this process.
Yeah, but for egg freezing, the girl has to be, I would suggest before the 35th birthday, one must do it. That other age limit is for doing ART procedures like donor egg cycles. Supposingly a 45-year-old lady comes to me. She is eligible to take treatment with us because she's less than 50 and she can have a donor egg because at
Right.
45, I will not find her own eggs.
Right.
But for egg freezing, I recommend before 35th birthday.
Right. Okay. Okay. Understood. Understood.
At 45, certainly she can go through ART procedure, but it will not be with self eggs. At that point of time, it will be with donor eggs.
Okay. Understood. Now,
But let's say a 60-year-old woman comes to my clinic or a 58-year-old woman for donor eggs. Well, that's not allowed. There's an age limit there, and rightly so. The government is right in putting it across as an age limit, because if you have a child at 60, by the time you're 80, the child is only 20. So are we using this technology to produce orphans? Morally wrong.
Fair
So
point. Yeah.
fair point.
Yeah. Now, when I think about law, the other thing, especially connected to medical practices, that comes into my head is that, in the big cities, Delhi, Bombay, Bangalore, Chennai, Calcutta, I'm sure the government is able to use the laws. People are complying with the laws largely.
True.
But what happens in the smaller towns, villages, where also people have money?
True.
Right? The landlords have money and can go through these treatments. Is there misuse of these practices, this medical?
Law will reach anywhere. One day it'll be caught.
Okay.
So better to refrain from it. Country is one, it's one law.
No, it's better to refrain, but I'm saying...
It can happen, but one day or the other it'll reach every nook and corner and you'll be answerable for it.
Mm-hmm. Are there practices, since you are the expert here and you've dealt with thousands of couples and helped them, are there practices that you feel should change, or you feel could become better, or you feel some people are misusing?
I don't think I would like to make a comment on that. I think one has to stick to your own self as to what you can do and what best you are doing. That's it.
Right.
Why
Okay.
make a comment about somebody
Sure.
else?
Sure. Okay. Now, my other question is about the couples that come to you, right, and their families. Is it mostly the very educated, upper middle class people who are doing this?
Now
How are
the
their
awareness has risen. Now there's a lot of awareness on this. So people from every walk of life are coming to us. Even uneducated people know that, there are treatments available. They read somewhere, they come across.
So the awareness of this has gone?
Yes. Last
Okay.
decade has seen a major impact on this awareness part.
Okay. Now, India is still a traditional country,
Yes.
right? So for couples who are coming for this treatment, is it an easy decision? Are they suspicious of, will I finally get somebody else's eggs, or are
They
there
talk
families?
about it. They talk about it. They ask you these questions, and you have to assure them that nothing will be done without their signatures, without their consent. And if at all a third-party reproduction is being offered to them, then they need to know about it. Their consent needs to be taken, and then one can do it. And once you counsel them nicely, properly, that with your eggs it is not possible, or with your sperms it will not be possible for us to give you your genetic child. Those are last resorts. But then if they are discussed, counseled properly, maybe they don't agree to it immediately, because the first reaction is very natural for them to, take a step backward and say, no, I don't want it. But a month later or 2 months later, you call them back, again speak to them, gradually that acceptance comes. Because I always, I use one example to counsel my patients. I would talk about, I've already spoken once earlier also about it in some podcast. That is that, if kidney fails, what do? You go borrow. That time you're desperate. The entire family is desperate to arrange for a kidney, right?
Yeah.
So if the ovary has failed or the testes has failed to give you the egg or the sperm, either situation, then why is there so much a problem to accept? Because you need a child in the house. You see any child across the road or in your relatives, your friend circle. You do like to cuddle the child or say hello or pick up the child and, try to show your affections. So one child, if you've taken through a donor egg or a donor sperm and you're bearing the child, you're delivering the child in that situation, nobody will get to know about it. Why will you not be happy with that child in the house whom you've delivered?
Yeah.
So I always ask them this question: what if kidney had failed? Would you say no? Would you sit in the house for 2 months, 3 months, or take so much time to decide? So kidney is also an organ. It's a body part. Ovary is also an organ, or a testes also. So it can happen to anybody.
Yeah.
It doesn't see to whom it is coming. But the question is, why me? That's what bothers you. So the answer is, it can't be why me. It has to be try me. As simple as that.
Are there any side effects of this?
No, nothing.
No side effects.
No
Nothing
side
for
effects.
people to be
No.
scared of?
No, nothing at all. Absolutely nothing.
Okay. What about the child who's produced finally? Is there any difference in the
In
children?
my experience, done many cases. ample number of cases.
Yeah, of
and
course, thousands. Yeah.
Thousands. And I've met those children. I sometimes get invites for their birthday parties. I always counsel the couple that, look, I will not remember. For me, if I meet you somewhere in a birthday party or a social gathering or in the market or in the mall, well, for me, it was an IVF child. How, what, inside the lab, that's a closed chapter forever. Confidentiality maintained. So you also forget about it and let me also forget about it, because this is how it has to work.
Wow. So what kind of confidentiality does the law ask you to maintain or ask the couple to maintain? Can the couple share with the child?
As of now, there is no such thing in India right now, but it will come sooner or later that they can find out their genetic parents. But as of today, we are not entitled to for this.
Right. Okay. And what kind of surrogacy, what level of surrogacy is happening in our country, in our planet?
See, now the surrogacy law is in place, 2021. Indian law is there. It says that, surrogacy should be altruistic surrogacy, which practically is not possible. Nobody comes for altruistic surrogacy. It's practically just not possible. They've also understood it.
And what do they mean by altruistic surrogacy?
Your own relative should do it for you, your kith and kin, somebody from your own family, not possible.
Don't pay somebody to do it.
That's not possible. It has to be commercial surrogacy, and it has to be from a registered ART bank. Some agency has to provide the surrogate to you. And it's a law, it's a legal document made there that it is a contract with 4 people, the couple, intending couple, and the surrogate. If her husband is alive, then her husband and her have to both sign that this is under this contract, there will be an embryo transfer done on her, and the child belongs to the intending couple there. So there's a legal document, there's a permission from the medical board, ART board, which is there. Everything is documented. So the doctor's responsibility there becomes much lesser. So if all the papers are in place, you've done it correctly with right indication there. And like, for example, if somebody already has a child and you've done, there will be no permission given for the second child.
Oh.
You can't opt for surrogacy to have a second child. No, it's not allowed.
Why is that?
That's a law.
So you can have a second child through normal procedure.
But
you can have 3 children, 5 children.
But you already had the first child either normal or through surrogacy. But you're not entitled for second time surrogacy. If you have one living child by any means, second time, if you come and you want surrogacy to be done, well, that is not happening now. It used to happen earlier, on demand. On demand surrogacy is now totally no as per the law.
Very interesting. So surrogacy has almost become a thing which is not easy. There is some criteria based on which you can get it.
Absolutely.
Otherwise, you can't get it.
Otherwise, you can't.
Oh, very interesting. So, any reason behind this that if you have a child, the second one can't be? Or
that's the law, but see, they don't want surrogacy. As the woman who's going through it, they feel that the exploitation of surrogates. But they were doing it left, right, and center for money. Now there is going to be some registry where one surrogate cannot do it second time also. Because ultimately, if she has 2 children of her own and she continues to do this, how many times can you permit her to be somebody's surrogate? So they put it only as once. But then if you have one child, you cannot go for second child through surrogacy. No, not allowed.
Very interesting. So it's only one. This lottery is available only once.
To have a child is once. I mean, if you want second child, you can have your own second child through your own uterus. But through surrogacy, no. You're not entitled to ask for it.
No, but for somebody who cannot have a child.
Even then, if you already have one child.
They can have only one through surrogacy.
Yes.
The second one is not allowed. Whereas a couple which can have through normal procedure can have 5. There is no law stopping that.
Yeah.
That's very interesting. The other question which, you don't have to name anybody, but my concern or my question is that while there are people like you who are trying to do good work and who are trying to help people, for everything there is a bad cop also.
Absolutely.
There are people who are trying to misuse it and who are perhaps, I'm guessing, who are not following the law completely and so on and so forth. So for the genuine couples, how do they find out that this is a good place to come to? What questions should they come with, or how do they evaluate? Because there might be many companies.
Because every clinic now needs to register for the ART, with the ART board, that whether you're allowed to do surrogacy or no, there's a certificate for that.
Okay.
So if the clinic is registered,
Okay.
you need to see that. If
Okay.
that
So
clinic
one is a certificate.
certificate from the ART board, there is a registration there. The clinic has to be registered. You look at the doctor's experience, figure it out, take the market opinion, take the reviews from the other patient. These days, it's very easy to figure out. So not so
Right,
difficult
right.
to find out which clinic you must choose.
And are there select few clinics in our cities and
No,
countries?
we have a lot of clinics now because registration is being given to a lot of good clinics have been given registration already. So there is no dearth of clinics.
Okay. Okay. So there is a lot of them.
Absolutely.
And you're saying once a registration is given, largely they are good.
Yeah.
So one doesn't need to worry.
No.
Do couples who come for these things, are there common fears, common insecurities?
Yes, there are a lot of questions in their mind as to, can we meet the surrogate every month or every visit of your consultation after she's pregnant? Will she carry the pregnancy properly? Who will look after her during those 9 months? There are various questions they will come up with, and at least 4 visits, 5 visits, they will first, like to understand everything and then get into this program.
Right, right. Interesting.
And rightly so. Why not?
Yeah.
It's their right to know everything.
Yeah, yeah, absolutely. So, in a large country like India, with a very young population who are all going in for marriages, there is the youngsters. At what stage should people become conscious of what habits should I inculcate to make sure I don't face infertility as one of the challenges? Is it teenager?
Eat right, exercise right, and work-life balance is what one needs to learn. And meditation is must. Yoga, if you can include in your curriculum, well and good.
And a majority of our country is not doing all these things.
Especially the younger generation.
Yeah. So do you think because the younger generation starting teenage, the common thing is the burger, the pizza, the
Yes,
sandwich.
yes.
And then you get into a top college, you want to have a top job, stress comes in, work-life balance goes for a toss. So do you think we are headed as a society to a place where a lot of people are going to face this? The percentage is going to
Yes.
grow?
Certainly.
Yeah.
Certainly.
So there is more need for people like yourself, but maybe a greater need for the advice to the younger people on how to be careful. But perhaps they are so young, they're not thinking about this.
Not right now, but it'll strike them a little later.
When they're 20, 25, 22, you think you can conquer the world and,
You can fly.
You can fly.
Family is not required.
Right.
Only when they realize that, no, this is not. I think we need to coach them. We need to tell them
Right, right.
that everything is important. Balancing is the first thing that is important to live complete.
Right. What's the average?
After all, it's only one life. Make it complete. Everything is important.
Yeah. What's the average age of couples that come to you?
In their 30s,
Okay.
early 30s to late 30s, even 40s, people are coming now. They realize by the time they get married, it's 37, 38. And they said, 1 year we tried. And then, for those couples, I would say take 6 months and then immediately come. Or rather, if your marriage is getting late, as I already mentioned, that first thing is egg freezing.
Right.
And even for men, I would say at least get one basic semen analysis done right in the beginning so that you're reassured that you have time to try and then you can come later. At
Yeah.
least 1 year of trying and then later. But if your age is already higher, then don't wait for even 1 year. Just get your test done, reassure yourself, or maybe even 6 months is enough.
Right, right. Okay. Interesting. Great. This has been very useful, eye-opener actually. I had no idea about how much this problem is growing. And at the same time, the good news is that there are treatments. There is
Yes.
IVF out there. There is people
But
like
don't
yourself.
keep it as an option to get married late, or, this should not come up like this. Plan it out.
Yeah.
Think about it, how you're going to manage.
Though, considering how the world is moving, how society is moving, this is the world that wants instant coffee, right? We don't want to put in a long-term effort to achieve a goal. We want to get it quickly. In some ways, I'm assuming that solutions like IVF that are coming in almost empower that woman to say, I don't need to care. I can smoke every day, a packet of
I
cigarettes.
wouldn't say that. I wouldn't say that. I will not agree with that. Even smoking every day and the egg quality is bad, then even IVF
You're
is
harming
not.
yourself.
Yeah, and IVF is not going to help you there. After all, quality of the gametes is important. Whether it is the egg or the sperm, IVF lab is only going to make embryos out of that egg and that sperm. So if it is bad quality egg, well, the embryos will be bad. IVF is not an 100% result anywhere in the world. It is 50 to 60% per embryo transfer. So if the quality of the gametes is bad, the embryos are not good quality, then the results are not going to be there.
That's very important.
So how
So you're
does-
saying don't use this as a solution
No, this is not a
to
solution.
develop bad habits
Exactly.
and say I can later take the
No.
pill which
That's
will
what
help
I
me.
said. People think it's a press button technique. It is not a press button technique. So it has its own limitations there.
Be very careful. Interesting. Okay, so last question. Any particular case or incident which you think we can learn from? You don't have to name anybody.
Yeah, there was this young girl who came to me. She was from a corporate MNC. She was working there from same place, Gurugram. And she was 39-year-old and married for almost a year. So she came to me and her AMH, the very first blood test that we did for her, that was anti-Mullerian hormone. And it was 0.1 nanogram per ml. So I had to, next visit, I had to tell her. Her husband's semen analysis was normal. So next visit, when I told her, I said, look, your AMH is pretty low. So let's see if IVF can work. Otherwise, the last option would be, how much are my chances? I said, see, for every young woman, I would say 50 to 60% per embryo transfer. But in this case, there is less chance of having multiple embryos. So she said, no, just tell me my chances. I said 30%, 20, 30%, depending on what egg quality I get. Numbers, I'm telling you, there's only one egg in right ovary and two in the left. So with three eggs, I do not know what number of embryos that we'll be able to make. And then finally, after transferring, 20%, 30% chance I'm giving you. She said, then why should I sit here in the IVF clinic? I don't need to be here. I thought with IVF at any age, at 39, I'm not too old. You could give me a baby. I said, there is individualization of the case. If same 39-year-old girl had an AMH of, let's say, 1.92, maybe an egg quality, good egg quality, she could have become pregnant maybe in the very first attempt. So no doctor can give you guarantee. So one has to understand the limitations for IVF, the results for IVF success. It is certainly not 100% anywhere in the world. So that understanding, when they come with these false expectations, then it's a problem. Even the most educated people sometimes.
Right. So again, I think the core theme I'm getting from you is don't treat this as a silver bullet.
Yes.
Right. Don't treat this
Use
as...
it judiciously.
And your upbringing, your growing up, your habits, your diet, your lifestyle, your stress, are you a happy person or not? All those things are going to make a difference.
Yes, everything is going to make a difference.
You said something about not the mouse and the spouse, not the mouse, or something. So basically,
they're more with the mouse than with the spouse.
Yeah.
Quality time is not there. And then they come to the clinic and say, IVF is a press button technique. We'll have a baby through IVF. What's the big deal about it?
Right. So while it's great that we have these solutions, don't try to misuse them or don't try to abuse your body.
True.
And think that I will take the silver bullet and the switch button technology
True.
will just help me.
Absolutely.
Great. Dr. Bali, this was such a learning experience today. And I'm hoping a lot of people will learn and are already learning from your content and from your clinic. Thank you so much for doing a great job and helping the society.
My pleasure.
Thank you.